You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. So we're now going to be joined on the telephone. I think we're going to be talking about Viking disease. Firstly, thank you very much for joining us. I was hoping you could just introduce yourself to our listeners firstly.
Yeah, I'm Mike Hayton. I'm a consultant orthopaedic hand surgeon based in the northwest of England at the Wrightington Hospital.
So I think we're first going to talk a little bit about some of the myths and misconceptions about Vikings and some of their legends in the UK.
Yeah, I was amazed to hear that 40% of people believe that Vikings wore helmets with horns when they invaded the UK. I certainly thought they did, having watched horrible histories with my kids. And it's interesting that only 4% of the UK population in Kent believe that there's a disease called Viking's disease. And there is a disease. It's called, otherwise known as Dupuytren's disease, and it affects 9% of the population.
So why don't we really know much about it?
Well, it's very common, 9%, and there's a very low patient perception of this condition, which can cause significant functional problems. We're unclear why patients don't really know about it. Maybe they're embarrassed about the curling over of their fingers, but there's certainly plenty of resources out there to help them. It's more common in men than women. It's often passed down the male side of the family, but occasionally it can spontaneously occur without any family members affected. And functional problems that patients can get are difficulty shaking hands, catching their eye in the morning when they're washing their face. If their little fingers curled over, they can catch their eye when they're half asleep. And then also difficulty getting their hands in their pockets, into gloves, into a handbag. Those sorts of things can cause problems. So
what are the reasons for someone getting it, and is there a particular age or reason for it?
Yeah, the reason why people get it is usually it's genetic, so it's passed down, and it's more common as we get older. So the majority of the patients that I see are certainly over 50, 55, but very occasionally it can occur before that age group.
So how can it be detected, and how would somebody know they might be suffering from this problem?
Yeah, so if a patient just looks at the palm of their hand, if they see thickening, scarring, irregularity, nodules, and perhaps their fingers curling over, and they're unable to get their hand flat on a table, they may be affected. And it might be worth asking a male relative whether they've got the condition. And if they have, it may be that they've got it. Perhaps go online, go on Google, have a look at Google images for Viking's disease in the hands and Dupuytren's and see whether it looks similar. And there's a great new website, which is a great patient resource. It's called thisisdupuytrens.com. That's spelled Dupuytrens. Thisisdupuytrens.com. And there's lots of information on there for patients to find out more about the condition.
Is there anything that can be done if you do suffer with the condition?
Yeah, unfortunately, there's no cure for it, but we can certainly improve function. The traditional treatment would be surgery, involving an operation and some scarring. But more recent treatments are enzyme injections, which can turn patients back very, very quickly and back to their normal function. And also radiotherapy. That can be performed in very early disease, particularly in the palm of the hand.
Thank you very much for talking to us and taking the time out to speak to us here at BRFM Bridge Radio on the Daniel Monday Night Community Show.
All right, thanks, Daniel.